revised version to Enza, so the minutes will have his name spelled correctly.
Okay. So no comments, questions, corrections, other than that? All right, so we've had a motion, one approved, two second, all in favor?
Yep.
Aye. Okay. Approved as written. Second item on the agenda, the reports, Health Department. Staff, Jen, thank you for coming. I know you're a very busy person. And do you want to give us a little update on where we are with the COVID-19?
Right now, we have 194 positive cases. We have 25 deaths. We've done 4 drive-through testing. We're in the midst of planning a 5th, but that's to be worked out. So far, we did the food delivery again yesterday, the schoolhouse at Millport and Canaan Parish, to a total of 53 seniors. That was the second time we had done that, working with the Board of Ed and Dr. Lutzie's group, because they're also doing the Meals on Wheels for Waveney. Then we did the mass delivery handout to all the restaurants last week. We did 90 small businesses on Friday as well. So we also did the drive-through pod with the CERT team and police in Waveney of 2,600 cars. That was around 11,000 masks that Saturday. So in total, we also did delivery to all the condos beforehand, which was, I believe, around 53 condo units and complexes, over 1,000 units. We did that with the fire department, and it works. Because again, the intent of everything the health department is doing is to keep seniors home in their houses safely. So we've given out almost 30,000 masks total since the beginning. That includes to Acme, Walter Stewart's, all the pods, Silver Hill, Waveney, Home Health, Staying Put, churches, etc. So we continue with that. We're working on now the relicensing of salons and their reopening guidance. I've already sent all that out. And we're assisting them on what the salons are going to look like when they go to reopen per the governor's orders on May 20th. We're also working with camps that are going to be reopening on June 29th and any guidance they need, even though they're regulated by OEC. They're still asking for our input. So we're helping them with that. The restaurants, May 20th, can do outdoor dining. So we've been working on a plan for downtown and Forest Street with Public Works and PD and Tucker Murphy to see what that can potentially look like. We also did the farmers market approval. That's going to be opening up on this Saturday. I will be there in the morning to inspect, make sure all the vendors are properly separated. That is a drive-through only model. So that's the way we're operating right now. That got BOS approval as well. All 300 slots are full for this market. They do offer home delivery. So those that couldn't get into the market, we advertised the link for them. They can get the farmers to home deliver. Again, there are issues with the food supply. So as much as we can help fix that, that's what we're trying to do. We do not want anyone going hungry during a pandemic. So any things that we can do to assist that, we are working on. And we are, of course, still having to do our normal work as well. Soil testing, septic inspections, building permit plan reviews, P&Z comments. So as you can imagine, we've been very busy. We also got 100 Tyvek gowns I got from a supplier. That 75 I gave, the pre-cut gave to Russ's group to sew. 25 were done through Aggie and Lynn at Lapham Center, because they've been also a tremendous help to us besides the Board of Ed. And their sewing group put together 25. I'm getting another 100 more today because there's a severe gown shortage in Connecticut. Even the hospitals can't get the gowns. So we are reinventing ways to do things and making our own little factory here. We put together 100 face shields as well. So those are ready to go, and we're going to offer them to the salons when they reopen and any restaurant staff that will be face-to-face and not, fully comfortable. That will be offered up to them as well. So that's where we're at right now.
Jen,
To go
Jen,
on.
could I ask questions?
Yep.
When you say we, who else besides yourself is involved in all this? Because that's a lot of work you've just described.
There's only 3 of us in the health department. So my staff has been phenomenal. Deborah Katz and Chris Wegerson. They are here with me every single day. They do not complain. They help out. We have Jill from the fire marshal's office when we need administrative help. Again, with delivery, the fire department and public works. Yesterday, the 4 public works guys helped me with the food delivery at schoolhouse. The CERT team helped me packing it at South School. So we are getting help, and Cheryl helps, get me people when I need, because we do have a lot of departments that are very helpful in the public. Anna Krolikowski helped me do the restaurant mask giveaway. Tucker Murphy's been a great help. The residents have really stepped up to help me as well. So I have a great little team going here, and we're used to being busy, so
Oh, thank you.
a little busy.
I had a question. You mentioned 104 positive tests, and I know you contact every person who falls into that category. I believe that's the case. And
Yep.
I asked,
The ones at Waveney. The ones at Waveney I just handle through Russ. So
but in your contact, you get a sense of how they acquired it, and what are you seeing on that front? Did they get it from another family member? Did they get it because they have a job that requires them to be out and exposed? Or did they just get it out of nowhere? Like, what are you seeing on that?
well, in the beginning, it was people commute to New York, went, vacationed. It was very clear cut. The new cases, they haven't gone anywhere because they can't go anywhere other than a grocery store. So, that's where we're finding it. And then the people that are isolating at home are giving it to other family members. So I do have linked cases, because as much as you try to isolate at home, it's very, hard to do that. And in my electronic database, I link those cases together. So it's in the system. There's also those that live alone, like, the person in schoolhouse never left the apartment, but she has home health aides and home cleaners that come in, and there are other outside sources that come in. Russ can tell you full well how hard that is to, control. And that's where we're seeing them now. Going forward, the state health department's working on a new database called Contact CT. We will not be using EDSS anymore. And the school nurses will be agents of me, of the director of health, because by statute, they have to work for the health department in order to do the contact tracing. So I will now have the school nurses to assist. And that new database is gonna be linking all the towns together. We can view each other's cases to make contact tracing more viable, where instead of me having to call this funeral home, this nursing home, et cetera, you put it all in the database and it will mesh that together for you.
Oh, great. And my last question, and this may be something you're not totally involved with, but what do you see as the prospects for reopening public schools and all schools in the fall? I can say from my family's experience, they're desperate to get back to school. The home learning is a very substitute for real learning. But I just wonder how do we do that, and what do you see as the prospects?
Well, it's going to be re-envisioned, that's for sure. But Dr. Lutzy and I make that decision together by statute. So, and obviously Harrison, as their medical director, will be a big part of that process. So right now, maybe Harrison can give a better picture.
I can give as good an answer as anyone, and that's TBD.
Exactly.
No one knows. And yes, the mandate or permission, we can organize it and see how we do it with the governor's order at that point in time. But it is going to be different. There's going to have to be some spatial accommodation, et cetera, and how that's done in terms of shifts days, who knows?
Yep.
But we are not there yet, and it's not for the foreseeable future. I think there is supposed to be an announcement in terms of summer school coming out. I'm sure it'll be a continuum of the e-learning phenomenon, but that's TBD also.
All
It's
right.
just, it's too early to tell where this disease is going and how quickly it's going to drop or not. And the disease is just such a complicated, unpredictable kind of scenario. As Russ alluded to, you go through various stages of discovery with this disease. So a few weeks ago was, yes, the clots. So MRIs, CAT scans were showing blood clots throughout the body, younger people too, especially lungs, strokes. Then you go on to all the neurologic complications, and almost every neurologic disease that you can think of that's not metabolically related has shown up, from encephalitis to meningitis to Guillain-Barré, which is a diffuse weakness of the muscles, and that may cause some people to require a ventilator. It's just an all-encompassing thing, and the heart issues have come to the fore. It's the COVID disease is just, the heart is a major component of this, with predictive value and not how much heart is involved. It's probably the most complex toxic disease that I have seen in terms of these numbers. You can get severe bacterial infections and rarely severe viral things. This number of, the obvious, the pandemic, the number, but the severity and the toxicity and the multiple systems that this virus attacks it's all encompassing. And it has a lot to do with this little ACE2 receptors, which are on a number of cells, from the lungs to the kidneys to the heart to wherever. So anyway, and it's taking its toll. The treatments these days are, you've gotten all the press about the remdesivir, which seems to be somewhat helpful. They're using it. The supply is limited. They are using it on an experimental basis. Just controlled studies in the hospitals, which unfortunately have to be sick enough to get it. And I think Gilead's the name of the company that makes it. It's the same company that produces the Tamiflu for the flu vaccine. For the flu virus. And, the Tamiflu is supposed to be a helpful antiviral as long as you got it to the patient in the first couple of days of the illness. And unfortunately, it works in a similar but somewhat different way to prevent the virus from replicating, as does this remdesivir. But when they're severely sick, they've had this for a minimum of a few days and often a week or 10 days. And so it may be, they acknowledge that it may be a little too late, but that's what they're saving the stockpile for, to give it to these sicker patients on an experimental basis. Presently, the hospitals are, their numbers are down probably from 2/3 to a half overall in terms of hospital COVID patients in the hospital and also in the ICUs. But along with all the other unpredictability is that there was a bump up in the numbers over the weekend. And I think it was yesterday, the state of Connecticut had a plus 34 hospitalizations. So it hasn't disappeared. I don't know if and when it will. But the hospitals are juggling. They're planning for the future. They're preparing for COVID phase 2 and trying to reaccumulate lots of PPEs and what have you. So it's still an ongoing, as you know, very significant disease in our community and everywhere.
The hospitals have also switched to using the blood plasma more. That seems to be helping with treatment, and doing oxygen instead of the ventilators. So that seems to be working from the beginning cases. I'm seeing a lot better outcome.
Yeah, the feeling with the plasma is that it is helping. There are no control studies, but the sixth sense is that it's helping. And the same thing with remdesivir. They think it is helping, but you're not sure yet. They've also learned, going along in the process of dealing with the patients, they've learned how to handle the oxygen differently. When they used to have if you couldn't maintain your oxygen level, your pulse ox in the 90s, at 6 liters, you were put on a ventilator, 6 liters per minute. And now they're going up to about 30 with a high flow oxygen. They're using the ventilators yet, less, and they think that is helpful. Ventilator has its own problems, especially with high pressure. So they're improving the way these patients are managed. Some of the newer things with the remdesivir and with the plasma are seeming to be helpful. But so there is a little bit of progress in terms of treatment, but nothing, as we know, in terms of prevention.
Jim here. I have a question for you and Jen Harrison. When I looked at the from last month and they talked about people dying, 62 cases, and now it's 194, 25 deaths. When you think of 19 deaths in a town this size, unbelievable. When I receive handlers the report, it seems like the curve is flat for us in terms of death at 25. Do we know how many people, standby group or emerging cases, and or are we pretty much going to be able to hold on 25, 26 people for a while?
You want to answer that, Jen? You want me to? I think we can both answer it the same way. It's hard to tell.
Yeah,
You like
but
decreasing numbers. Go ahead.
But I would say a lot of what Russ has been doing it's been phenomenal with his new methods of testing everybody, has been great for Waveney, and the not transporting so much to the hospital. We've seen a severe, slowdown and control. So I think that has helped as well.
So there's a possibility that we could have another 19 to 20 deaths in the next month before our next meeting.
Hopefully. Go ahead, Russ.
Yeah, Russ here. I mean, I'll just add a couple things. I think our experience is that the protocol changes that the hospitals have made from early on when they started to get overrun with COVID-19 patients have dramatically improved. So there were extraordinarily high mortality rates, at least for the over 90 age group that we take care of, over 80, over 90. That has gone down dramatically. That's number one. Number two is we have a lot of patients who are on hospice. We have 120 patients over the age of 90. And some of those numbers were patients that were already on hospice care, were on end-of-life care, and the COVID-19 disease just accelerated that a little bit. So Jim, from our numbers, and Jen and I talk daily, and I can't tell you, for those of you that have spent a lot of time with her, she's doing an incredible job with her department and division. But when you take some of those hospice patients out of the mix, the number of deaths is quite diminished, if you will, Jim. So right now, everything is being reported, even congestive heart failure, hospice, COPD, one foot in the grave. If you are testing positive for COVID-19, then that stat is. So I would just say, and Jen could probably give you a broader number for the community, but a significant piece of those numbers are hospice people that were very, very frail and very sick and are now getting the stamp of COVID-19 because they've tested positive.
I think the previous numbers of 80 to 85% of COVID positive patients are treated as an outpatient, with about 15% or so being admitted. I can give you the numbers of Nuvance, which is Norwalk is part of that 7 hospitals consortium. There are 3 major hospitals, of which Norwalk is one, but they have had 300 deaths and slightly over 1,000 discharges with COVID. So that gives you a little perspective on that number.
Thank you all. Okay.
Let's see. Let's moving ahead. Senior and Adult Services. Bethany, you're on.
Hey, Jen, are you gonna pop off? What are you doing?
Okay, thanks.
Yeah.
Oh, Jen, you there?
Yes.
You have done a phenomenal job, and it's just great that you don't need to sleep.
Thank you, Harrison.
I have to say, I come here in the morning and Jen's car is here. I leave at night and Jen's car is here. So Jen, when do you go home? It's amazing. Thank you. So the report for my food pantry distribution or food distribution, we have, including the 15,000 grant from New Canaan Community Foundation, we have about $35,000 in the food pantry special projects fund, which is phenomenal. We're ordering food through Acme for our next distribution, which is May 19th. It's going to be a drive-through model again. That's proven very effective. And slips have been emailed. There will be no gift cards this time, just food pantry slip, filling out the items that they want. Enza is putting an incredible amount of effort into this, and it will be all non-perishable items. Acme has stopped delivering meat as well, just because they run out all the time. So we're no longer doing the meat for that purpose. So the other thing is we're thinking, I mean, do we do this once a month since they're only non-perishables? I mean, we're able to give out 4 weeks worth of food. But then we have to think about also when the Gospel Garden starts producing the vegetables in June. So anyway, we're just toying with the idea, just in terms of if this event spins up again or whatever, we are going to be giving a little bit more food this time other than 2 weeks, just in case we have to postpone things again, just being very cautious. And then senior grocery shopping. We are maintaining about 200 seniors that continue to use the volunteers for their grocery shopping. And that has been working out so great. They're now, relationships, rapports are being created, and the prescriptions are being filled by the volunteers helping to get those. If not, Shannon is working with CVS and the senior population and getting their prescriptions delivered on a 3-month basis through CVS. Walgreens seems to be more user-friendly. And then we have the New Canaan Pharmacy and Greenwich Pharmacy, which are delivering. So that's going smoothly. But that kink of prescriptions needed, we're seeing less and less of us running out really quickly to get the meds and delivering them. So that's being more streamlined. The mask distribution, we've given out over 600 masks. Over 300 of them have been used, have been from cloth masks, people making them, or police gave us about 150. We have run out. We have given them all out. And so we've, once again, the community is incredible, and they are getting their sewing machines and fabric out and starting another run. I know we gave some to Waveney Care. They requested some. We've given, oh my gosh, over 100 to Staying Put, and then people are just picking them up as well. So that's going well for the mask distribution. Do you want me to go into seniors, Harrison, as a whole?
Sure. You mean as opposed to new business?
Right, yeah. Just let me keep going with just my normal senior.
Yeah, just sure.
Okay, so we are seeing, also, let me go back a little bit. The food pantry itself, we're seeing an uptick. We normally have about 130 to 140 people, which is equivalent to about 40 households coming for these distributions. We're now up to over 150 individuals, which is it's over 50 families coming for food support. But this is excellent with our special projects food pantry money. We're good. We're good in order and able to accommodate these people. Let me see. So back to Shannon, who is our part-time, whom we've stolen from land use, and we understand we will have to give her back. She's been invaluable. She is calling all residents 90 years old and up, and has found that the response has been very positive. Aggie and Lynn continue to have their weekly call outs to those that have requested contact through a phone call. They are not computer equipped. And so this phone call is very important to them. I continue to call out the vulnerable population list along with the RNs, and we seem to be very caught up. Some are feeling more comfortable. They said, we'll call you. That's very reassuring, and they know they have our number, a number of numbers. So that's a very positive response. What else? We note that just overall, the programs that we're doing and the seniors, things are just settling down, and we have more of a flow coming in terms of our clients and their needs for state and local programs. The fact that they have been delayed 2 or 3 months, they're not getting the letters, so we're not doing as much DSS, social service program renewals and things. That's going to be more down the road, which is nice. It gives us time to be focusing more on this one-on-one calling out. Right now, I'm thinking we're looking, based on the SWACA meeting that I had yesterday, it's a weekly 3 p.m. meeting with the area directors and SWACA, Agency on Aging. There was a technology meeting yesterday, and overall, the whole area seems as if Zoom is the place, that's the platform that we can do outreach to seniors and make them feel less isolated. So we're going to start a program. We're going to work on that, which I will go focus on more on new business. But there is still that isolation of those that are not computer equipped. And there are a couple, like Family Agency, they do have phone call classes. We're using those more, but at the same time, it's not enough. But it's the increase in phone calling, that's really all we have available right now because of the isolation, the distancing. So we're continuing that, but we're just upping our phone calls and letting them know about online phone call discussions. The fact that Zoom meetings, you can also call in on a phone, that's very confusing to them because it is technologically based. So this basic phone call, pick up, answer, get on a conference calling to them mentally. This is where we're at with many of the seniors. We do have some of the seniors saying, do not call me. Thank you very much. And those, we respect that privacy and that free will, but we do have them marked down to maybe check in every now and then. We don't want to insult them. At the same time, we do want to check in with them. Let me see. The phone calls we're getting, we're having longer phone call conversations when people do call. I do see some behavioral health issues starting to form, and there's more family situations, more acting out based on the stress and anxiety people are feeling to a greater degree. Jackie can go into that. That's more family based. I do have more adult children calling me saying that they they're having a hard time dealing with their parents. They're not listening to them. Once again, our conversations are longer and more involved with more or less family functioning and relationships. What else? I can give you some phone, let me see. I'm still waiting to hear back from IT for phone stats, but we've had a huge increase. We've done more in the last 3 months than we did all last year. So it just shows that people do know where to call, and we are calling out. We are definitely helping more people with their rental assistance as their COVID assistance is running out, and the stimulus packages, that money is running out. We are trying to get them to talk to their credit card companies, their landlords, their mortgage companies. They also do have programs in place. So we're asking them to contact those entities first to see, because this is going to be a long haul, and maintaining their level of living. We can't sustain it as human services paying for it each month, but the important thing is to get in a program with all their debt entities. We are working with Touch of Life, Salvation Army, and our usual general assistance. And so that all those, we do have enough money. We're still capable and able to help people out. We're trying to do about $500 per person to help with their rent. It does keep the landlord, as well as working with some of the affordable housing complexes. They're very agreeable to it. And so that has helped. Trying to think, we have the list, the contacting seniors 75 and older. There are about 1,400 residents on that. We've reached about 70% of those 1,400 residents. We've been able, this is through Bob Mantilia and Shannon, Valerie, we've been able to, of those 70% that we have phone numbers for and reached out, either left a message, asked to call back. Some of them don't respond because they don't know the phone number. But we've made verbal contact with over 55% of those, almost 60%. And so we continue working on the rest. What else? We're doing a weekly recording, FEMA. We possibly might be reimbursed for the volunteers that we're using, over the 200 volunteers that are donating 1 hour a week with the seniors. So we are keeping a record. We have to, for FEMA, regarding this, it would be considered COVID expenses. So right now, the weekly extra hours, we're compiling the data. We send to Bill Osterman, who's in charge of buildings and overseeing the buildings, and he's with Public Works. Possibly if we're doing 200 volunteers per week, they're giving estimate about $25 an hour per volunteer. And so that's approximately $5,000 per week the town might be receiving, as I said, might be receiving in terms of payment for the volunteer base for this COVID experience. We also are keeping track of all COVID expenses, which has to do with Shannon having her full-time by the hour, as well as Enza's extra hours. So that is my update. Any questions?
Yeah, hi,
So-
Bethany, it's Russ. Thank you very much for
Yeah.
your team and everything that you guys are doing.
Likewise.
We are exclusively using N95 masks and have been for quite some time with all of our caregivers, and using face shields. We tend to, we oversupply and we over purchase. So there are times and occasions where the traditional surgical mask, if you would, we will have a supply of. We've had other nonprofits come to us and ask for those, as well as the state has been giving an allotment of masks that are poor quality, but they are certainly a step up from the cloth mask. So if there's any time that you come where you need a couple in that category, they're certainly better than cloth. And we're happy to help if we can. So please just reach out to us. I'm not sure I can put 300 together at any one point in time, but certainly,
Thank you.
50 masks or something like that, just to get through a tough period. Please feel free to reach out to us on
Great
that.
to know.
I just had
Yeah.
do we keep track of unemployment? I mean, I'm thinking about all the restaurants and all the businesses that have closed. I know
No.
most of those are people coming in from other areas and other regions to work in the restaurants, but do we have an idea of kind of what our unemployment rate is right now in New Canaan?
No, with the Department of Labor, we are not touching, with the Department of Labor, we're sending people to the website to apply and fill out applications and see if they qualify. I do not, and I'm wondering, I think we can go to the Department of Labor.
The follow-up question of that is, I know you
Yeah.
talk about rental assistance and helping. We can't hire enough housekeepers, and we cannot hire enough food service people right now during this pandemic. So I've said this in anyone that's willing to listen to me, in terms of unemployment and rental assistance, if people are willing to work, we have jobs for them. So so please feel free to
Yeah,
those.
we have. We
Okay.
definitely, that is something we suggest. And definitely we say Waveney is hiring. And you can go on the website and do the positions available. That's what I tell them, to go to the
Yep,
website. So, yeah.
Absolutely.
Jim,
Excellent.
I want to build on your unemployment question, since the other half of my life is in unemployment. I was on a call on Monday with the Department of Labor. There are 365,000 filings for unemployment. 310,000 have been processed. This is all since the beginning of the year. You look at 2008 to 2010, they basically were doing about 12,000 an entire year. The department now begins to forecast by July a 20% unemployment rate in the state of Connecticut, which is not too different than what forecasting for on a national basis. But the fact is, again, we were at 4.3% in January. We're now going to be facing 20%. The reason all these numbers are interesting and should be to the commission is that's going to trickle down to the town of New Canaan, for certainly the state of Connecticut. And from that standpoint, I'm watching that on a weekly, if not daily basis, because they're expecting, again, up to 500,000 people unemployed by summer. And that all impacts the services that Career Resources provides. But the net of it is, that's one hell of a lot of people. And the fact is, the ramp up of reopening is take a long time. And that 20% is probably going to be achievable. And so Russ, you're going to have a tough time recruiting people. Maybe we can be of some help because we have 30,000 standing in line for jobs before the recession. So now it's probably 100,000. Anyway, the net of all this is the number crunching is that it's going to impact what's going on in Health and Human Service big time. And we are not immune.
No, agreed. Thanks for that, all the stats there, Jim. Yeah, the food pantry will be busier, the rentals, supplements, right down the line probably. I did like the little comment, maybe flashback to, the adults are not listening to the children like it used to be. The kids weren't listening to the adults. So, what goes around comes around. Anyway, thank you for that. Now, and Bethany alluded to some of the mental health problems, which brings us to our next topic, the Youth and Family Services. And this May is Mental Health Month. So, Jackie, you want to take it away? Are you finished, Bethany?
I just want, IT just sent me the stats on the phone, and we last month, we had 780 phone calls, and this month we have over in April alone. I mean, it's only April, April 7th. We have about 500 and something. It's incredible. The people are calling in, but that's good. I will add them all up.
The phones too, the nurses, Janet Reed, and she's a supervisor, and all the school nurses, they were doing due diligence with the senior citizenry and actually developing friendships. And it was the school nurses deal with the kids all the time. Then they're dealing with the seniors. There were, relationships were formed, et cetera, enjoying it. And now Jen is going to be borrowing them and going to be doing a lot of contact tracing with them. So even though school is out, the school nurses are in.
Definitely.
Terrific.
Okay, Jackie, you want to?
Thanks. Well, Russ, just to comment on what you were saying, I definitely have gotten out that you guys are hiring to most of my families. I know that one father was very interested. I think I encouraged, is it Rebecca that is the great person that works over with you guys?
Yeah.
She had outreached with me after that last meeting. And so I know I told him, she said not to call the email, but he didn't hear, he applied. So I told him to just reach out with her because right now he's obviously out of work with his 2 jobs, but it's the only way he can sustain the family. The mom, doesn't have a green card, so they weren't even eligible for the stimulus because of that. And they have 2 kids in the school system. They're really struggling. Bethany and Enza have been amazing getting them food, and we were able to give them a gift card through MasterCard. Anyhow, but the issue with some of my other families, they have minor children at home that they just have no one to watch those kids. So that's the issue why they couldn't even reach out. So that does pose a problem. I'm hearing more and more from families every day, which adds to the mental health picture. You know, they can't be out of work 6 months and not sustaining, you know, their bills or, you know, the good news is for the subsidized housing clients, if you have no income coming in, they will stop the rent at that time. But that's, you know, a lot of them live with private landlords, you know, and maybe they could hold off a month or two, but they're going to expect that money. And if these people have no way of bringing it in, it's just, you know, we're just seeing the problems like unfold every day.
Yeah.
As you probably know, my topic was domestic violence, mental health, substance abuse. All those numbers have skyrocketed. You know, just trying to triage where we can, you know, sort of get those people linked up with services. The good news is that this virtual, like telehealth, is amazing because people can access it, you know, way more easily than they've ever been able to. I hear from some therapists that there's, you know, the HIPAA guidelines have kind of, you know, released a little bit where they, you know, made them a little more lenient so these people can get the phone calls if they can't do the FaceTime stuff. I mean, so that's amazing. And I think when I hear from treatment centers like Mountainside, Silver Hill, like their numbers are up. I mean, these calls are skyrocketing, which is good news, and their programs are being able to, you know, sustain these people. But I think was on a Zoom the other day with Jim Himes about maintaining mental health with DMIS and the hub in Norwalk. And, you know, his take was really, he has to go back to Washington to say, I mean, we cannot cut this funding because we're seeing that they want to slash these programs, but we know these people, you know, are going to need these resources even more than they did. So that's really concerning. But, you know, we've just had a lot of challenging situations. I've had a lot of suicidal ideations with middle school aged kids, adults. You know, one woman, just not to give too much information, she had called their main number and then got linked with me. She has COVID at home. Her husband's in a New York hospital. She has not really been able to have any contact with him. She doesn't know if he'll make it, you know, and have a high school age daughter. So we were able to get her linked up with a therapist for free because she cannot make any co-pays or, you know, he hasn't been working and she doesn't work. And it's been amazing to find these people that are doing this work for free. You know, I've had some people waive a copay if the person can at least put it through insurance, but then they're not expecting the copay. I know they're not going to be able to do that forever, these therapists, but it's just amazing the people that are willing to help. I've had to call on a couple people more than a few times. So, but, you know, and then our police department obviously has been busy. My domestic violence coordinator just got promoted. Now he's the youth officer. So I believe he's going to be doing both those roles, which will be good. I know I'll be utilized a lot more with those young adults that have, I mean, I've already tried to help families with young adults that have substance abuse, mental health problems. And, you know, I'm reaching these families and I mean, they don't want their kids even at home because it's but there's nowhere they can go. I mean, you know, it's like, it's unsafe for them to possibly go to a hotel. I mean, we've had to, you know, help a couple in those situations. I mean, homeless shelters don't have any availability. You know, some of them I think have had to put people in hotels if they've had outbreaks. It's just everyone's getting creative. I think Jen mentioned it best. Like we just have to get creative with, you know, what we're doing. And what I'm finding is there's so many people willing to help. I just think we need to keep reminding them of these resources. Jen sent me something this morning that I'm reading but the American Red Cross is launching a virtual family assistance center. It will be a website where individuals and families can go that have been affected by COVID. Connecticut looks like they're leading the charge on this. We're the first state. So when I hang up on this, I'm gonna get some nonprofits to get a lot of their resources uploaded so people know that this is another service that they can utilize. That's just it. We just need to, 211 is giving out our number a lot and telling people, oh, they'll pay all your bills, but we have to explain to people we can't do that. But where we can kind of link them up, and person to person is working with our community foundation for small businesses, New Canaan and New Canaan employees, to help them kind of, that's a new program. That's amazing. I just, every day I'm amazed, as sad as the stories that I hear and the people that I'm going to help, I just hear all the amazing work that's being done, and I'm just blown away. So any questions, anything that, and Harrison, your podcast was amazing. I thought that information, that was a stellar panel, and you guys did a great job. Hopefully you've all got to listen in, or if you have some time, please check that out. That's the Talking About It podcast.
Right. Yeah, I thought Dr. Gerber from Silver Hill and the two employees or therapists who are connected with Hope, and it was good to see them, because Hope was something, at least from my previous life, that I used way back when, and then things changed there, but I think they're back and functioning well, and definitely a good source for those in need. And thanks for the information. I mean, all this stuff it's depressing to hear and see what's going on out there. It's great that you still have your list though, Jackie, right, of 30 therapists, and they're available, so you haven't had problems connecting these families with people, with the therapists?
The free pro bono stuff, I've said to Bethany, we've tapped a couple of people a few times, but again, if people are willing to utilize their insurance, but maybe they'll copay, like places like Family Centers, or Chelsea, Julianne, who you worked with on that podcast, they can do a sliding scale, but they really wouldn't turn away. The same as like Child Guidance. Child Guidance opened a program for really behavioral, health issues with youth. It's a voluntary program, and they can go out to where the family is. That's the other part, is I'd love to utilize them in our office to use the space, but I don't know if that'll be allowed when we're up and running. This is just such a challenging thing. We'd love to use the free office space we have, but will we be allowed to have extra people come into those spaces? I don't know that that's going to be safe. But the virtual stuff, like I said, it's, funny enough, I've said it now for several weeks, but now I'm hearing our state reps saying it, people in mental health. We're going to keep these platforms, one, because they're safe, and two, they're really highly accessible. I mean, for a parent to have to, drive after a work day to get across to Stanford or wherever they have to go, this virtual stuff makes it so easy to sit in the comfort of your home and, do the therapy there. I think that's something that I think will just stay. I'm impressed with that.
Yeah, I don't see the room at Health and Human Services being available for the foreseeable future. It's
no, I know.
too many risks involved, et cetera, et cetera. So, but the telehealth is major, and I think I just wonder, do we have the funding to provide co-pays if it comes down to that with some therapists, the need?
And Bethany might not know this. I've been with the Health and Human Services for, almost 15 years. I'm going on my 15th year, but we have done that in the beginning through our Touch of Life, but we found that when the recession hit, most people had insurance or Medicaid, and a lot more therapists are coming on the scene that accept that. But the answer to that, and Beth, it would be yes. I mean, maybe we could say we'd cover 10 copays if that's, $500. I don't think we could pay, a $200 therapist for,
No.
if there's a couple of copays. But like I said, a lot of these therapists would be willing to waive, maybe not an ongoing basis, but to get someone, sustained, so I just definitely think, we definitely, Touch of Life is one of our more creative funds that they're willing to do, whatever. And I know the school has used them for those services before.
Yeah, I think we have to think of payment. We'd have to work with each individual therapist to see if they could wait to accept payment. They have to then give us an invoice. There's a protocol here in order to get payment. So I think it's a great idea, and if it's just willing, the doctor, therapist is willing to work with us and not receive money immediately or before the event. And if they're willing to work with us and give us the billing that we need in order to qualify and support our reason for paying. So I think it can be done, and I think it's a great idea. I do think there should be a limit on the number of them per person, because that could, once again, it's the sustainability, the economic sustainability of these.
I don't want to be a broken record, but I'm listening to these staff reports from the front lines. I'm listening to the Department of Labor and some other folks from Hartford talking about what's coming and that it's going to be with us for a while. We're operating with part of a staff anyway right now. We better batten down the hatches and put some people on the wall. We're going to be deluged by fall, if not before. And so we need to shake the tree over across the way at Town Hall to get that job already been funded, filled, and then somebody's going to have to come in and figure out how to deal with this service I'll be asked to provide. Just saying.
No, thank you for your input. I have mentioned that and written to Kevin about that. Cheryl, you're still with us, right?
Yes, I am.
Yeah,
Right.
just the need, now and the perceived need more so in the future for an MSW to be of assistance and part of the HHS plan. And there are a few other changes. So you can
Yes,
carry that back.
I will, and Kevin is definitely aware of that.
Okay.
I didn't realize you were on, Cheryl. I would have said nice things about HR.
Thanks.
But I'm seriously concerned that we are undermanned big time against this need that's going to come up. And even New Canaan is not Hartford nor Bridgeport, New Haven, but we're going to have a number of people using that food bank. And you can see the numbers on the dashboard already beginning to go up. So just forewarned. And technology is not going to carry the day for it all. Human beings. Thank you.
Thank you, Jim. And Jackie, thank you. Are you anything else?
I'm sure there is, but I know there's probably new and old business to get to, but anyone can reach out to me. And especially if you guys need a resource. Alicia, thank you. She's put my name out there on Facebook Moms. The school has given my name, and a lot of people have reached out. So I think it's amazing. I'm available for any.
That's
Yeah.
great. Thank you.
Jackie, you've been unbelievable. You've been unbelievable with your quick resources that we all need. Thank you.
Thank you.
Thank you, Jackie.
Thank all of you.
I have a question. Could I just a quick, and maybe it's for Cheryl. The people on this call, the town employees on this call, they are busy. But I wonder if there are other parts of the town government that are less busy, where there are extra people available who could help. And I know there's a question whether they have expertise in the right area, but are we redeploying people in parts of the town government that may be less busy these days to areas that need more workers?
Yes, we definitely are. I think that's where Jen was speaking. We have had them help her with delivering food. We've had them working with Bob Mantilia on collecting numbers, reaching out to seniors. So we are definitely utilizing them, and we are in the process of putting a plan together to bring all employees back. So we will be continuing to deploy them in the areas that we need to.
Thank you.
Alicia, thank you for the minutes. Also, any updates that's been mentioned about school schedule, e-learning, et cetera?
like was mentioned at the beginning, e-learning. So for those of you who don't know, it was announced on Tuesday that the schools will remain closed for the rest of the school year, which I think everyone anticipated, but was still hard to hear. The schools really have done a phenomenal job with e-learning, but it's tough. I mean, I'm homeschooling second grade and I have 2 older children. It's hard. It's been 7 weeks now. So I think people are nervous about the fall and what the future is going to hold. And are we going to be doing this for another year? I think people have trepidation. The schools have been doing really a great job, though. I mean, they've really stepped up, but it's been rough. One other announcement: New Canaan Moms, which is a group I'm part of, it's a group of 3,000 local moms, and they've donated. I mean, Bethany, I don't know I asked Eielson the exact amount of money, Bethany, and she said she didn't know, but you would know. They've raised a lot of money for Health and Human Services clients. They've given gift cards to local restaurants. So it supports the local restaurants, and then it also supports the clients who are then able to go get a meal. And everyone there loves Bethany. Everyone at New Canaan Moms raves about her.
No,
Do
I
you know
love
how much money they've raised for the clients?
So last food distribution, they gave us $4,500 in gift cards for local town areas, so that the town, the food establishments received the cash, we received the cards, and so the clients could go out and use those resources. And they are doing it again for the next distribution. But they've also given out to our clients indirectly through to schoolhouse apartments, so many other things. Their tentacles are just completely through the community, and I just love them, and I do call them for help. We do need more cloth masks, and so you call Monica, you call Eielson, and I bow down to them. They are incredible, and it's just amazing.
Yeah, they're great. And I'm on the board of ABC House. They're doing stuff for ABC House now too.
Okay.
The ABC scholars have gone home. They're not in the house anymore. But they're doing some things for them and for the graduating senior, and some things. The house needs some work too. They're going to help pay for that. So it's been, wonderful. Jackie has been super helpful. There's been a lot of requests on New Canaan Moms with domestic violence and mental health issues, and people looking for resources and looking for resources for friends. And so Jackie has really stepped up and been wonderful. And so, we're just going to keep on trucking along.
Alicia, thank you for the role you're playing with this. It's significant. We
Thanks.
appreciate it.
Your podcast was great.
Recipients appreciate it more.
Yeah.
Thank you. Okay, let's see. Old business, Jim, you're back. How are we doing with the challenge grant?
A challenge grant went in 2 weeks ago for $5,000 that would be matched by local funds, which I'm just getting ready to start solicitation next week. Basically, the partners are Waveney, Silver Hill, the Hub, where I'm going to a meeting this afternoon for 2 hours to talk to 25 other mental health organizations in Fairfield County to see what's going on and see if I can learn anything from the professionals. But ostensibly what we're planning on doing is producing 6 programs that would be 30 minutes long on YouTube that feature a professional such as Dr. Gerber talking about, don't get too lonely because it's tough to get out of the ditch, whatnot. But at the end of the day, or the end of the program, then having some kind of an exercise, which the Hub, which is the nonprofit that's funded by the state for mental health for this area, has a whole bunch of games and things that would engage people and leave them with something to help their mental health development, if you will. One of the things that I just read actually that's relevant, and I sound like a number cruncher, but I'm only in my part-time job, but Stanford Hospital just ran, or every 3 years runs, survey of the community health needs. For the last 3 times, meaning 9 years, those surveys have been done. Behavioral health needs are the single biggest thing that comes out of it. So all of this, and I'm now becoming a gospel carrier for mental health, but particularly for seniors, mental health is tied to physical health, and you can't have a successful aging process if you haven't addressed both. So bottom line is that we use the AARP grant request, which is now in Washington and in Hartford. The decision made in Washington, July 1st, ostensibly the grant would be made. We were planning on having a matching fund, 1 or 2 local foundations, and the town's participation. So we got Wakefield Hill, the hub, and departments from the town are the fundamental partners in this thing of executing it. But Staying Put will be involved, Lapham, et cetera, et cetera. So it'll become a community effort before it's all over. So the essence, I'll end by saying that we started this thing looking at, or this AARP thing, on what's like the fact that 1 out of every 4 seniors had a behavioral problem issue to deal with. I would submit at this point in time, it's 100% have some version of anxiety, depression, loneliness, and whatnot. So that's going to become a big deal for us. Right now, we'll learn as we go, see what we can pick up this afternoon, and get ready to execute. And this program, by the way, would execute in September through December, mid-December. So it's designed to be quick and dirty, as I call it, in terms of the money must for the end of the year. The grant comes July, August, and they expect you to be executing by September. So that's what we've been doing with AARP, and are getting ready to approach the New Keenan Foundation and AT&T, which are my go-to people for small amounts of funding. We just need another $5,000 to $7,000.
Jim, I was just going to say to definitely contact Laura in Patterson, because I think the videos, their whole initiative is around behavioral health. She'd be the perfect person to talk to, and I'm sure they have the money. I know that they've also been doing a COVID response fund. I don't know if that's these small business loans, but she'd be the perfect person. She'd love to hear this.
Oh, absolutely. Yep. She's on my call list for next week for sure. As is
Good.
Anyway, so we started this whole thing by just looking at the normal problems of mental health for seniors and what they have to deal with for the aging process. COVID has accelerated this thing big time. It's like pouring gasoline on the fire from my standpoint. So I'll leave it at that. We'll see whether we win or not. I think we have a reasonably good shot. The only thing that would hold us back is, according to Hartford AARP, they only give away 2 grants for Connecticut out of this. And so I think we're in pretty good shape. Stay tuned.
Okay, thank you, Jim. Thanks for your work on the application. The other issue under old business, New Canaan Cares, Bethany or Jackie, you want to comment on that? Bethany, where are we?
Well, Ellen has left New Canaan Cares, and Sarah, she is going to be interim.
Schubert.
What's her last name?
Schubert. It's Leo Carl's sister, if anyone doesn't know.
Okay. So I've been working with her. What happened was, just so you know, the New Canaan Cares grant request at one point of $2,000. They were going to use it for programming, but that programming has been canceled. But it was passed last meeting that if they sent us an invoice for the $2,000 in other areas, that we would pay for that. So before Ellen left, she did send they owed $666 for the middle school leadership program, the part that they had not paid for. So Human Services covered that, as well as the other amount was for the $1,300. Hold on one second. I'm just pulling it up. I'm sorry. The $1,300 that went to other programming that they were still being billed for, that they had completed with those programs for the middle schoolers. So we finished paying off another $1,300 towards the items that still needed to be paid. So it totaled $2,000, and I've sent those invoices to finance. So that being said,
And they were happy with that? Because the
they
original
were so
request-
grateful. They were so grateful.
the
We just
original
repurposed
request
the
was
money.
for-
We didn't
Yeah, it was
decline what we said we'd give. We just repurposed it. Yeah.
But they wanted 4,000 initially. And
Yeah,
then we
so
left
the
it
other
to-
2,000, they were able to cancel. They do not need it. So
Okay.
it was, I mean, they would love it, but they could not give an invoice. I think it was passed last meeting that we would give 2,000 with an invoice, if there was an invoice.
right.
And so they've done that. They followed through with that, and we are issuing them a check.
Great, thank you.
Yep.
Okay, new business, I mean, we've discussed it somewhat, senior technology. Bethany,
Yeah,
wanna-
really quickly, with the SWACA meeting report yesterday, it is evident that New Canaan is so far ahead with their technology and senior aspect. With LAPM, the library, the Y, and Human Services with their telehealth program. We are just definitely steps above where other people are looking to be. And so that being said, the biggest concern with New Canaan is it is very time intensive getting one person onto Zoom. Let's say they have the computer technology and all that, but getting onto Zoom is very labor intensive. Lynn and Aggie are doing it. Pete Stair at the men's club, he's doing it with his guys because they want their Friday morning meetings to continue. But there is a gap. I was thinking, Alicia would know about this, at St. Luke's School, they have to fulfill a number of community hours before they can graduate. And I've had a senior approach me who is interested in a project. And I am thinking, and I don't know if Harrison or the commission wants to form a committee in terms of senior technology and partner with the library and LAPM and Staying Put and the Y to find out what seniors want to be on connected to Zoom. It would open their life up for many classes, many free classes as well. But we need to pair them up with one person to guide them through. I'm thinking this project, we could maybe try it, a little pilot project with St. Luke's to see if they can help us, the kids, this needing their community hours, to work with a senior and get them onto Zoom. And as a result, then once they finish with that, apparently talking to Aggie and Lynn, it takes more than one time working with the senior. And especially since we can't be there face to face with them. So it's very labor intensive. You have to have a lot of patience and a lot of understanding. And I just think this could be a great community effort with the young and the old and pairing them, just like almost we've done with the senior grocery shopping.
Bethany, has technology been an issue with them?
Pardon me?
Has technology been an issue with them in terms of actually having a computer?
So
with
they have it. These are people that have it. This would be a program where they have it. They might have a phone or a laptop, something. Maybe they do a little FaceTime with their family, this and that, but it would be their willingness to want. A lot of these people want to get on Zoom, but they don't know where to go. But they would love to try to get on Zoom. And this is where Aggie and Lynn have noticed it. With
Bethany,
Yeah.
Go ahead.
Well,
How
Bethany,
about-
we make those calls every week for Lynn Nagy. Could we ask people about whether they have room and whether they want to consider getting connected?
Yeah, if we could set something up, I mean, we could ask them that question. I would like to ask them that question, but if they say yes, we need to have that. Oh, okay, well, let me, so I would love to possibly just try this little pilot program through LAPM, through these phone calls, while working with St. Luke's. But I'm in touch, with this senior right now, and he's trying to figure it out too. I'm working with his mom. And we just, we might have something here, but the commission, what do you think? I mean, do you want me
Well,
to continue?
not opposed to using St. Luke's, but how about the volunteers that we have already that have developed some relationship with the seniors that they're doing the shopping for? And that may be the first step to go.
That's a
Okay.
possibility too. We can go from that angle. I wanted to keep it a little bit as a pilot. And I was just trying to fill a need where the senior needed quite a few hours. And I was trying to think of a human, Alicia, right? I was trying to think of a program through, he came to Human Services. So these
Why
kids
not-
are so tech savvy. I mean, but yeah, I agree. That could be, if we have enough seniors, it's supply and demand. And if we do need more, like you said, it can be done through the volunteer program as well. They've just signed up for senior shopping, but we could ask them about that. But I can see this growing, and yeah.
I mean, the link is a natural and it's there. There's already a relationship.
Yeah, right.
Yep.
But St. Luke's is asking too. So I mean that there's that link as well. I'd like to start with the St. Luke's link, or do you want me to try doing both links? Do we need further discussion? Do you want me to go with this? And sort of,
Well, let's get a quick input from the commission.
yeah,
I think you should do it as a pilot, but I think the devil is in the details. And having been a Zoom learning curve person myself, I appreciate the one-on-one, and it does take time and effort. Staying Put has a group of technology people who help, and so you might see what's been going on over there. But one or two people from St. Louis, because this is going to be a high intensity learning curve, I think. But it's a great idea. I don't know how you do it remotely. That's the problem.
well, that's the thing. It takes a lot of patience by the teacher or the student or the volunteer to have the patience to understand that an older person, just synaptically, neurologically, it is slower, and they have to have that patience. So if I work with one or two St. Luke's students and get their feedback, they can possibly, get other kids to help, but they do need training first too, to understand, a senior and their capabilities, their baseline where they're starting is a lot less of the terminology, everything is a lot less than these kids that grow up, with these things in their hands, these devices.
Can I make a suggestion?
Lance, what do you think?
Well,
You're a Zoom person, right?
I think you should start working with the St. Luke's, and I would recommend linking in with Staying Put, because they're in closer touch with the members, and a lot of our members are savvy and a lot of the members are not, and they would know kind of the psychology and technique of teaching. So
I've spoken with Barb and Nicola on this, and they would love it. They said if there was a go-to, if we could sign some people up. It's a lot. It's very, it's challenging.
I'll make a meeting. Let's do it.
Yeah, Bethany, I would also add, we have a great IT person at Waveney Life Care. Sometimes it's putting the instructions together, and you'd be surprised. There's a lot of people that still do not know how to use technology on the computer. It's just not the seniors, but I'm sure he would be willing to help put the instructions together so that it can be followed and it'd be a standard process. So we work with Staying Put as well, but I do offer up his his expertise to support you if you need it.
Great, great. So I'll see, I'll see where it
Bethany,
goes.
can I just say one thing?
Liz, yeah.
I would definitely echo what Russ just said about having someone, have some kind of step-by-step laid out so that these volunteers have something to follow, so you have some consistency. But I would also have them maybe practice with you once, just so you can be a sample person they're trying to keep.
Yeah,
So they can have some idea of what they're in for, and you can get a sense of
I
their,
think it's a great idea.
because you don't want to have a bad experience either.
Right, and there are more pieces to this. It's not just here. It's not like the grocery shopping thing.
Right.
Pair them up and go do the grocery shopping. I wish.
It's a little trickier than groceries.
A little trickier,
Grocery
and
shopping
there's some other components. There's some psychosocial components involved, and I would like to make this very effective, but I do think it has to be very step by step. And I love the IT idea of just getting a common instruction
Yep.
sheet.
I think that's critical.
Okay, I'm going to work on it more then.
Sounds good.
Okay, thank you. Last item, financial update, Bethany.
The financial updates. I told you the food pantry, we have over 35,000 and the donations keep coming in. It's incredible. We're talking, $10 to $2,000. It's absolutely incredible. So I'm feeling the love, and that's good. Our general assistance, this is winding up the last quarter of the fiscal year. We started out, our original appropriation was $22,000. We're down to, we have $6,400 left. We've used 70%, but I envision using this up in the next, 10 weeks for, with especially COVID. Public health services, we were appropriated $20,000. We still have $12,000 left. We've only used 36%. So keep that in mind. I mean, we are in a public health crisis right now. If there's something, whatever, this could possibly be used from other departments. I don't know, Jen, maybe health.
Yeah,
I don't know.
What are you using the public health for exactly? What was it earmarked for?
Well, we use it for the telehealth program. We've used, and from there, we've also done expenses. I've got to look and see. I don't know about the first 6 months. I have not looked to see what the appropriations were for. Actually, nothing was used except telehealth for the first 6 months. But we've had to go into, we were down for the flu clinic. We were short on funds. The amount of flu vaccine increased. So we only put in $8,000 for that expense, and we needed more. So we took more out of that to shore up what we needed for the flu vaccine. So we really have not utilized
that
this.
fund would help probably Jackie's point of needing the behavioral health component.
Well, we do have a line item for that as well. So that's why we're using it to get down to that. We have a community program wellness fund, and that is where we have used 80% of that, and we're down, we have $4,000 left. But we could use it, that would come out of the, for Jackie's thing, any of her needs. And like we said, the co-pays, that would be coming out of the community program wellness fund. If we had to go over, we could do the overflow into the public health.
Right, you could always transfer the line item. I would push that because your fiscal year ends June 30th. Or does that money go over? Can you carry over that money?
It will be, well,
No,
we cannot carry over that money, but that is something for the commission to decide on. But we have, that's why I'm saying we have some flexibility there. And
A month ago now.
pardon me?
Yeah, Dr. Pierce, from my perspective, I see Jacqueline's and Jackie and the behavioral health issues and things of that nature as being a huge need for our senior population that feels isolated. And certainly, if we can make that allocation more of an allocation to her so that she can work some of these deals out with the therapists that are in New Canaan, I think that would be a great use of those funds.
Well,
Okay, we'll see what the need is.
Yeah, we'll see what the need is. Seniors are very hesitant So it might not it'd be just seniors, I think the whole age spectrum. And
Right, because Brian Lutzy has said you can reach out to him, that they're having a lot of, issues with their kids in the lower socioeconomic. He's supporting also 7 families that's been tacked on to our 53 families. So there's definitely a need, and there's
Well,
definitely a way to
right,
get the money spent.
and Jackie has that, Jackie, are you there?
Yeah, no, I am. I mean, the issue is like, I couldn't scramble together what I'm spending that money on in, 1 month. We have other funds that we can tap. So like Touch a Life, the school has access to that as well. I don't think that operates on the same fiscal year as our, money does. But I don't know. I mean, you'd have to figure that out, Bethany. I don't know that can be spent on, like, we have a general assistance fund that gets spent on clients. Like, I don't
It's
know
not
that
that easy,
money
right.
can be earmarked for using it on a client, but maybe there's a community project. Maybe Mike Handler has an idea if we want to, instead of turning that money back, if there is something that
Well, I'm thinking,
needs to be
like,
purchased.
this is where the
PPE,
commission,
I mean, could that be used for PPE?
like PPEs
And-
and masks and things like that.
Yeah.
I mean,
I would imagine, and not to say that, because we can find other money for the mental health copays. I mean, right now we don't have any. I've been able to finagle people to do it for free, but in the next month, that's all that we have, to spend that by June 30th. I don't know. I think if there was something, that we could use it on.
I'm
for the
just
greater
putting it
community,
out
that'd
there.
be
Yeah.
Well, what about if we're not successful with the AARP grant request? With Jim's question, can we use those funds to help that set and back that program up?
Don't go money, because part of it belongs to the telehealth project from a year ago. And I agree totally, because with or without AARP's funding, we for 10 or 15 started on senior mental health. So by the time we meet next month, I will be putting together something with Bethany and Harris to present. But I could spend $12,000. I don't want to do the whole thing, but I think the town, this should be a public project. And regardless, money issue here, but there's to do whatever we need. Seniors, mental health, all big things that need to be addressed.
Yeah, exactly. So it's there, something to think about. And then for COVID, we have 2 separate line items for COVID, but totally we've spent, our expenses have been about $6,000 towards COVID, which I am inputting, to FEMA or to Billy O, and keeping track of that. And so hopefully we will get reimbursed with that as well.
Okay, thank you, Bethany.
You're welcome.
Thank you all for attending. I think we've gone beyond our time limit here. May I have a motion to adjourn, please?
Before you make that, I just ask one question real quick. With all of the help, with all the assistance, is there any way that the commission can put together for Bethany kind of a draft letter of thanks and appreciation and have all the commissioners sign it so that it goes out for all of these organizations that have pitched in, and then I'll make the motion to adjourn.
Yes.
Great idea.
All in favor?
Yeah, aye.
Opposed?
Yep.
Okay, thank you, Russ.
I second the dismissal.
Okay, everybody, be well.
All right.
Thank you.
Thank you.
See you in a month.
Bye.
Or before.